Yes, I am a parish nurse.
Okay.
The terminology today is more so faith community nurse. Parish nurses treat their congregations as their faith community as well as the neighborhoods that the churches are located in. So she's actually an advocate not only for the congregational members, but for the members of the community outside the walls of the church. So basically what I do now is I work with churches to help them identify health and wellness needs within their congregations and outside the walls of the church in their communities. And then we help them develop and build health and wellness programs to address those needs. We actually have 3 outreach ministries now called Bear Closets, B-E-A-R, Baby Equipment and Resource Closets, where families, low-income families, can go and get all of the supplies and equipment that they need in order to provide good care for their babies. And they start from preemies. They serve preemies to age 6. So they can. Nursing, health is more than just physical, and that's where parish nursing really has we go one step further, where we complete training on spiritual care. So we take a real mind, body, spirit approach as far as health and wellness. They can have their blood pressure checked. They have connections that the nurses, who are all volunteers, can provide connections to community resources for housing, electricity, establishing a primary care physician. We have some young women come in and say, well, how do I apply for WIC? Do I qualify for WIC? We have people come in and say, I'm a diabetic and I can't afford to get my medicines. Can you help me? And so we can connect them to all the appropriate resources to keep them. I may have somebody come into my office who says, I've been diagnosed with Parkinson's disease. And even though the doctor explained that to me, I need some help with that, and here are my medicines. So there's teaching, educational opportunities. I may have an adult child of an aging parent come in and say, Mom's been really confused lately, and I'm worried about her driving, and she got lost last week, and I'm not sure what kind of care she needs. Can you help me with that? Parish nurses are, not always, but usually they start maybe middle-aged once they have some experience, that kind of thing. Not always. They're seasoned, so to speak, but not always. In essence, parish nursing helps churches, and I love this is what I love about it. It helps the church become another portal of access to health and wellness. Because lots of people may not be able to get downtown or to a doctor or a hospital, but they can get to the church that's 2 blocks down the road from them to get their vision screened, to have their blood pressure checked, to get their flu shot, to get counseling on medicine, all those preventative health promotion type things. That's what parish nurses do. My background's actually neuroscience and cardiovascular disease and rehab. I worked 14 years. I provide lots of community education. I work and collaborate with community agencies such as the Council on Aging. A complete lipid panel screening. They have counseling one-on-one, and then we can coach them on how to, decrease their cholesterol. And at the same time, we can do a stroke risk assessment. The real focus is health promotion.
Yeah.
You get to be somebody's cheerleader and advocate, personal, one-on-one, so to speak. So prevention, promotion of health, promoting optimal health, prevention of illness and disease, huge advocacy role, referral process, connecting them to other agencies and that can help prevent them from falling through the cracks. There's probably about, I don't know the current numbers, about 50,000 1,000 faith community nurses.
Wow.
Right now across the country and abroad. There's also parish nurses. Most of them are volunteer, working with churches in the Asheville district.